Dr. Weisfogel is my savior, I have to tell you. I came to him from another dental group, and I won't mention the name, that practiced 18th century dentistry. I'm a double recovering cancer patient. I was cancer-free for 28 years and then was hit with bone cancer and lost my femur to bone cancer. And through the steroids and the chemo and everything else that goes with it, your teeth loosen up. And I had 17 root canals done because of loose teeth. Got infected, the teeth had to come out. So I had no teeth in the top, and I had just a few teeth left in the bottom. I went to this other dentist, and I don't know why they didn't take those teeth, but they didn't. They made me a plate, upper plate, and they made me a lower plate. A partial. The upper plate was so badly made that where this is in the center, it was over here. The bottom plate, partial, was so badly made that every time I ate, it cut my gums, and I would have a mouthful of blood. When I came to him, after having it had adjusted 5 times, the female dentist that was working there said to me, that was doing my work, said, "Well, I can't adjust this anymore. You're just going to have to learn to live with it." To me, this was totally unacceptable. I came here, I called for an appointment, and I came in. Dr. Weisfogel took one look at what was in my mouth. I took the partial, popped the partial out, and threw it across the room. He said, "This is 18th century dentistry. I can't see why they're doing it." By this time, my whole bottom jaw was infected from the fact that it was being cut every time I tried to eat. He looked at the top piece and he says, "Oh, no. He says, "This is also wrong." The only thing he could do at this point in time was to pull the remaining teeth on the bottom because it was just massive infection. We discussed the implants. He suggested this is the best thing in the world for me on the bottom. And then we proceeded from there. For me to be able to go out and have a steak as I did last night in a restaurant, and to know and feel safe in eating that I'm not going to, first of all, I'm not going to have a mouthful of blood, and secondly, that my teeth are secure, that my smile looks great, that I look fine. This is, to me, priceless. I would have paid twice as much. I wish I had found out Dr. Weisfogel before I went to the other place. I would have saved myself a lot of trouble. I have recommended him to a number of people, and what I also like about Dr. Weisfogel, I sent one of my elderly friends to him, and he was very forthright to her. He said, "Look, sweetie, you're in your 90s. I am not going to put you through the problem of implants and all of this." He said, and he told her exactly what to buy to help to keep her false teeth from slipping. I mean, he could have, as other dentists might have, been unethical enough to say, or looking at his bottom line to say, "Well, I can get X amount of dollars." He didn't. He told her point blank, "I don't want to do this. I mean, I can if you insist, but I don't want to do this. You don't need to put this expense out. Just go and get," and he mentioned the dental adhesive, and she did, and she's fine with it. I mean, after what he did for me, the man walks on water as far as I'm concerned.